Hello everybody, today we will talk about the blood supply of upper limb. Identify this structure. This is the arch of aorta, and arch of aorta, it gives total 3 branches. This is the brachiocephalic trunk or brachiocephalic artery present in the right side, then left common carotid artery and left subclavian artery. So this is the brachiocephalic artery which divides into 2 branches. This is the right common carotid artery and this is the right subclavian artery. This subclavian artery it extends from the arch of aorta or from the brachiocephalic trunk to the outer border of first rib. Identify, this is the first rib which is overlapped by the clavicle bone. This is the clavicle bone, this is the first rib. We cannot palpate the first rib because it is hidden by the clavicle or it is overlapped by the clavicle. So up to the outer border of first rib, this is the subclavian artery. Then this subclavian artery continue as axillary artery. This axillary artery it extends from outer border of first rib to the lower border of teres major. This muscle, this is the teres major. This is the bicipital groove. This is the medial lip of bicipital groove. This is lateral lip of bicipital groove. So at this medial lip, here is the insertion of teres major muscle. On the lateral lip, here is the insertion of pectoralis major muscle, and in between the two, this is the groove which is known as the bicipital groove or intertubercular sulcus. So in the previous class, as I told you, total 3 muscles are inserted in relation to this bicipital groove: teres major, pectoralis major and latissimus dorsi. So this is the teres major muscle, and up to the lower border of teres major, this artery is the axillary artery. Below the teres major, this artery becomes brachial artery. See here in this. So this is the teres major muscle, and below the teres major, this artery becomes this artery. This is the teres major muscle. Below teres major, this artery becomes the brachial artery, and the brachial artery it gives first branch which is known as the deep femoral. This is the brachial artery, and this is the profunda brachii artery. This is profunda brachii artery, which run in the radial groove along with the radial nerve. Then this brachial artery, at the level of the neck of radius, it terminates by giving 2 branches: radial artery and this is the ulnar artery. So ulnar artery it is running medially, radial artery it is running on the lateral side. So this is the thumb lateral side. So this artery is the radial artery. So see this. Now come back. So this is the subclavian artery. Subclavian artery continue as the axillary artery, and identify this muscle. This muscle is the pectoralis major muscle. This muscle is pectoralis minor muscle. It arising from the costocartilage of the 3rd, 4th and 5th rib. So this is pectoralis minor muscle. Origin from 3rd, 4th, 5th costal cartilage, and it is inserted at the coracoid process of scapula. So pectoralis minor muscle crosses the axillary artery and it divides it into 3 parts: the first part, second part and the third part. And total axillary artery gives 6 branches. From the first part it gives 1 branch, from the second part it gives 2 branch, and from the third part it gives total 3 branch. So we will write these things. The blood supply of upper limb. It begins with subclavian artery. So subclavian artery it extends from arch of aorta to outer border of first rib. Then subclavian artery, it continue as axillary artery. It extends from outer border of first rib to lower border of teres major muscle. Then axillary artery continue as brachial artery. This brachial artery, it extends from lower border of teres major muscle to neck of radius. Then this brachial artery, it divides into the two branches, radial artery and ulnar artery. So now the next point, this axillary artery is divided into three parts. By pectoralis minor muscle. The first part is proximal to muscle. Medial. It gives one branch, and the name of that branch is superior thoracic artery. The second part of axillary artery, this is posterior to muscle. Second part, it gives two branches. Their name thoracoacromial artery and lateral thoracic artery. The third part, that is the lateral or distal to muscle. This third part, it gives total three branches. Their name subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. So these are the total 6 branches. So question is axillary artery. Axillary artery gives total 6 branches divided into 3 parts. The first part gives only one branch, superior thoracic artery. Second part gives 2 branches, thoracoacromial artery and lateral thoracic artery. Third part, it gives total 3 branches, subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. Now see this subscapular artery, this is the largest branch of axillary artery. Lateral thoracic artery, it is bigger in females. Why? Because it supplies to mammary gland. So these are the branches of axillary artery. Now one question, anastomosis around scapula. Occurs between first part of subclavian artery and third part of axillary artery. Anastomosis around scapula between the branches of two arteries, subclavian artery first part and the axillary artery third part. Third part branch, subscapular artery, its branches anastomose with the branches of subclavian artery. Now see the branches of subclavian artery. It is divided into three parts by scalenius anterior muscle. The first part, it gives branches, their mnemonic is VIT or vitamin. The second part, it gives one branch, that is the C, and the third part, it gives a branch, it is CD. So mnemonic is vitamin CD. What are the meaning of this? V for vertebral artery. I for internal thoracic artery. TT for thyrocervical trunk. C for costocervical trunk. D for dorsal scapular artery. So these are the total 5 branches from the subclavian artery. So first part is the internal thoracic, thyrocervical trunk and vertebral artery. So this thyrocervical trunk, branches of the thyrocervical trunk, anastomosis around the scapula with the branches of the subscapular artery. So again the anastomosis around the scapula between first part of subclavian artery and third part of axillary artery. Now the next, this brachial artery. The first branch of brachial artery is profunda brachii artery. Then a terminal branch, radial artery and ulnar artery. Now this ulnar artery, it gives a branch that is known as common interosseous artery. This common interosseous artery divides into the two branches, anterior interosseous artery and posterior interosseous artery. Anterior interosseous artery and posterior interosseous artery. One artery run on the anterior surface of the interosseous membrane present between the radius and ulna bone. The second artery, posterior interosseous artery, it run on the posterior surface of the interosseous membrane. Now we will focus around the anastomosis. Anastomosis around elbow joint. Important topic. Anastomosis around elbow joint. Look at this picture, this. Anastomosis around elbow joint, it happens between the branches of the brachial artery and the branches of profunda brachii artery superiorly, and the branches of the radial artery and the branches of the ulnar artery. See, the anastomosis around the elbow joint, it happens around the medial epicondyle of the humerus and around the lateral epicondyle of the humerus. This is the medial epicondyle of the humerus, and it has two surfaces. One is anterior surface, one is posterior surface. So there are total 4 arteries, or on each surface there are 2 arteries, like on the anterior surface. One artery is coming from upside, one artery is coming from the downside. Similarly, on the posterior surface of the medial epicondyle, one artery is coming from upside, one artery is coming from the downside. On the lateral side, anterior surface around the lateral epicondyle, anterior surface, one artery is coming from upside, one artery is coming from downside. On the posterior surface, one artery is coming from upside, one artery is coming from the downside. So see in this picture, identify the bones. This bone is the radius bone. We can easily identify this bone is the radius bone. So this is lateral side, this is medial side. So around the medial epicondyle of the humerus, around the medial epicondyle of the humerus, one artery is coming from the upside, this artery. This is known as the inferior ulnar collateral artery, which is the branch of the brachial artery. This anastomose with the branch coming from the downside. This is known as the anterior ulnar recurrent artery. Remember, on the medial side is the ulnar artery, lateral side is the radial artery. So ulnar artery gives recurrent branches, anterior ulnar recurrent artery and the posterior ulnar recurrent artery. From the upside, this is the inferior ulnar collateral artery and the superior ulnar collateral artery, which are the branches of brachial artery. Then from the profunda brachii artery, it gives anterior descending branch and the posterior descending branch. Anterior descending branch of profunda brachii artery present laterally. It is also known as the radial collateral artery. And then posterior descending branch of the profunda brachii artery, which is also known as the middle collateral artery. They anastomose with the radial recurrent artery anteriorly and the intraosseous recurrent artery posteriorly. Intraosseous recurrent artery is the branch of posterior interosseous artery. Here, this branch, this is the inferior ulnar collateral artery, this is the superior ulnar collateral artery. Both are the branch of brachial artery. This is the profunda brachii artery. The one branch, this is the anterior descending branch. This is the anterior descending branch, also known as the radial collateral artery. And this is the posterior descending branch of the profunda brachii artery, also known as the middle collateral artery. So this anterior descending branch, it anastomose with the radial. Identify this branch. This is the ulnar artery. This is the radial artery. जो lateral side में the artery which is running in the lateral side, this is radial artery, and on the medial side this is the ulnar artery. The first branch of the ulnar artery, this is known as the common intraosseous artery, which divides into the anterior intraosseous artery and the posterior intraosseous artery. This is the intraosseous membrane. So running on the anterior surface of intraosseous membrane, anterior intraosseous artery. Running on the posterior side, this is the posterior intraosseous artery. So this posterior intraosseous artery, it gives a branch which is known as intraosseous recurrent artery. This is the intraosseous recurrent artery. This intraosseous recurrent artery anastomose with the posterior descending branch of the profunda brachii artery, or middle collateral branch of the profunda brachii artery. And this anterior descending branch or the radial collateral branch, it anastomose with the radial recurrent branch of the radial artery. So I would like to write these branches making anastomosis around elbow joint. Anastomosis around elbow joint. It is present along medial epicondyle and lateral epicondyle of humerus. So along medial epicondyle. anterior surface. What arteries are making anastomosis? From superiorly, the artery is coming. This is known as the inferior ulnar collateral artery, which is the branch of brachial artery. From inferiorly, this is anterior ulnar recurrent artery, branch of ulnar artery. Then posterior surface of the medial epicondyle. One artery is coming from superiorly. This is the superior ulnar collateral artery. This is the branch of brachial artery. Inferiorly, this is posterior ulnar recurrent artery, branch of ulnar artery. So there are two arteries present anteriorly around the medial epicondyle and two arteries present posteriorly. One is coming from superiorly, one is coming from inferiorly. Now the anastomosis around lateral epicondyle. Superiorly, anterior surface, superiorly the artery is radial collateral branch of profunda brachii artery. Inferiorly is the radial recurrent branch radial artery. Then posterior surface of lateral epicondyle. One artery is coming from superiorly. This is the middle collateral branch of profunda brachii artery. And inferiorly, this is the interosseous recurrent branch posterior interosseous artery, which is the branch of the ulnar artery. This is the branch of common interosseous artery. This. So this is the anastomosis around elbow joint. So these are the two terminal branches of the brachial artery, radial artery and ulnar artery. Radial artery runs on the lateral side, ulnar artery runs on the medial side. The question is asked, most commonly examined artery is the radial artery. Peripheral pulse examination is done via radial artery. So where we palpate the radial artery palpation in lower 1/3 of 4R between the tendons of brachioradialis present laterally and tendon of flexor carpi radialis, it is present medially. So between these two tendons, radial artery runs in the 4R. So this is all about the blood supply of the upper limb. Thank you so much.